Thank you very much, Henry Ascher, for coming to Oxford and participating in the Autumn Academy. It was really interesting to listen to how healthcare has been provided to irregular migrants in Sweden. Would you please sum up for us what were the key points of your presentation today?
Well, I think factors that were important to make a change was commitment by health professionals and relating very much to the professional medical ethics that demands us to treat all patients only out from the health needs and not considering any other aspects or who you are or in what social situation you are. So that was one very important factor which led to the creation of voluntary professional health clinics in Sweden providing or securing healthcare for undocumented migrants, and that was in the second half of the 1990s. But also these clinics started a lobby work to make a law change, and this work was very much strengthened when the UN Special Rapporteur on the Right to Health, Professor Paul Hunt, came to Sweden, invited by the government, and issued a report where he was extremely critical to the discrimination in the health system of asylum seekers and particularly undocumented migrants. And since human rights are considered very important in Sweden and amongst Swedish public, this was really creating a very good basis for pressing on a change. So by the initiative of the clinic, a Right to Health initiative was launched, which in the end gathered some 70 plus organizations covering the whole Swedish civil society, all the big humanitarian organizations, the Archbishop and all important churches and religious organizations, the big trade unions, and all health professional organizations. After some time, it was a lot of political quarrel and split among the government parties, where the Conservative Party tried to block development, but in the end there was a law which came into place in 2013. Still not equal health care, but recognizing that even undocumented people have the right to human rights and the right to health.
And why was it so important for medical professionals to support development for the extension of the entitlement to healthcare for irregular migrants in Sweden?
Well, I think it's a very important basis in our education and in our work that we should treat all patients in the same way, only out of the health needs and on the basis of science and evidence, not taking any other considerations. And the health professional organizations even regard a situation where we have to ask the patients, who are you, before we decide how to investigate or how to treat, as a working environmental threat or problem, creating problems for us from a health environmental point of view also. We should never be put into that situation. So yeah.
Thank you very much.
Thank you.